we all know good mental health and well-being is crucial to thrive in the workplace. However, racism, COVID, the murder of George Floyd and what happened in America this weekend are other significant incidences that have a huge impact on people from an ethnic minority background, and it continues to do so. So can we just ask Alicia, first question, as an expert in this area, can you expand on how people from an ethnic minority backgrounds might have been affected?
So I'll start with COVID then. So there's been lots of research and evidence around why people of colour and Black people have been disproportionately affected. One such report was by Business in the Community in 2021, and they found that people of colour are more likely to face financial insecurity, bereavement, job losses, and lower access to care, which are all risk factors for poor mental health conditions, which increase their vulnerability. The City Mental Health Alliance also published some research in 2021, and they agreed that people of colour were more likely to have had experiences during the pandemic that have contributed to poor mental health as well. So yeah, the next few statistics demonstrate how people of colour are more likely to say that they don't feel that the workplace is as inclusive as they would like, and they feel pressure to change their behaviour to fit in compared to their white counterparts. So that's, yeah, things around not fitting in, changing behaviour, and not being able to be themselves, which all contribute to loneliness as well. So thinking about Mental Health Awareness Week last week, for which the theme was loneliness, you know, that is a recognised risk factor for mental health conditions. And, you know, when you can't be yourself in the workplace, that really does impact your ability to feel, you know, in an environment where you're supported. And then moving on to, you mentioned George Floyd, and it is around the anniversary right now. You know, whilst it's positive that, you know, we're talking about race equality more, and, you know, lots of people are being proactive in providing that support, there is the other side of that, which is that, you know, it can be triggering for people of colour and Black people, particularly thinking about the George Floyd murder. You know, it can bring back traumatic experiences that they might have had, and it highlights inequalities. And, you know, as that slide, you know, really sympathetically showed at the beginning, it's, you know, at this time of year when people are remembering that, it can bring that impact back again as well. So overall, you know, all of these things compound to be exhausting, which again is a big risk factor for mental health conditions.
So how can organisations support their ethnic minority employees' well-being, and what internal resources and support can they put in place?
So I think one of the key ways is these networks, so staff networks around different characteristics, including race networks, but, you know, making sure they're effective and really integrated into the organisation. So, you know, making sure that they're safe spaces in any way that the organisation can, and that, you know, bringing them into consultation around race equality work, asking for their opinion on things like policy development and equalities work that's happening across the organisation, and really value the contribution of that network. So, you know, not particularly or necessarily providing a financial reward, but, you know, in some places I see it tied into promotions processes. I see it recognised in performance reviews, that kind of thing. So, you know, really kind of valuing the support and input of that network, and listening to them as well, you know, listening to people of colour and Black people across the organisation. And one such way you can do that is through these networks. And then taking action, as you mentioned earlier, you know, taking action based on that feedback you get as well. Having a senior sponsor can be really, really effective as well. You know, someone at that top table who can really push that agenda forward and kind of be the face of it across the organisation. Another thing that's really helpful is having mental health first aiders. And it's really important that they're representative of the staff group. So, you know, making sure there are people of colour and Black people represented in that group as well, and other intersectional kind of characteristics and represented in that, you know, reflect the staff cohort. Education and awareness raising for all staff and for managers as well. So there are some brilliant training programs and trainers out there around race equality, but also there's lots of stuff on the internet now, and there's lots of self-learning people can do. And, you know, creating spaces for people to have conversations as well. You know, it doesn't have to be about bringing trainers in. You can just, you know, you can do that self-learning and create those brave spaces as you were talking about. Also representation. So, you know, seeing people of colour and Black people in senior posts, bringing them into projects. So you're hearing all the voices in that room and across the staff cohort, at events and in campaigns, making sure that you can see those people and hear those people. and really kind of embedding inclusion into everything that's done. So that might be reviewing kind of your existing policies, so HR policies, for example, through an anti-racist lens, you know, to see where they might disadvantage people of colour as well. So really just looking at the whole piece. We do have some resources on our website at Mental Health First Aid England as part of the My Whole Self package, and I can share a link in the chat after my section.
And I think picking up what Alicia said is you know, there are a number of things here, and you know, our theme is action, not just words. So I think if all your organizations are you know, walking the walk and implement some of these, or showing ethnic diversity at leadership level, then obviously, you know, they are helping by default. It's where they're not doing anything, that's where the impact will continue. You touched upon, and I know it's your organization, Mental Health First Aiders, and I've heard from many organizations the fantastic impact they have in their organizations. But we also hear that for many ethnic minority employees, there aren't Mental Health First Aid Englanders, aiders, sorry, with lived experience. So how can organizations encourage more from an ethnic minority background to become a mental health first aider? Okay, so
we know that people of colour and Black people have different experiences to white people around mental health. So, for example, you know, they might have access treatment through police or criminal justice route. They're more likely to have and experience restrictive interventions, things like that. Recovery through IAPT is significantly lower for people of colour than their white counterparts. And that was published in a Mind Briefing document in 2020. But because of things like this, people of colour know that their experiences are different from their white counterparts. So they really want to speak to someone they can relate to immediately. And they don't want to have to spend time contextualising everything. So in order to encourage more people of colour and Black people to be mental health first aiders, I would say initially reach out directly to the group. So that might be via these race equality groups. And if you are a lead of one of these race equality groups, you know, you can proactively approach whoever looks after the first mental health first aiders as well, and ensure that the training is culturally inclusive as well. So, you know, our program, 2-day program, really does make sure that it's culturally inclusive. But there's lots that the instructor can do as well to really build that conversation into the program and communicate this. So when you're recruiting mental health first aiders, talk about how it's culturally inclusive. Let your staff know that that's really important to you as an organisation, and perhaps consider using trainers that are people of colour as well. Again, you know, referring back to the previous point of, you know, people that might feel more comfortable talking to a mental health first aid or being trained by people in mental health around that, and then profile the people that are already mental health first aiders and people of colour as well. So, you know, you might do that as part of a race equality campaign, but you might just do that as part of the mental health first aid campaign, but just make sure people can see those people that are of colour that have already taken on these roles. And again, our guidance does include, you know, information about making sure that your mental health first aid recruitment processes are reflective of your staff cohort as well. So worth checking that out as well.
Brilliant, thank you. Just to wrap up on a quick couple of questions, Alicia. So what advice would you give Race Network leaders, which many of are here today, when it comes to looking after their own well-being and of their members?
So I would say, you know, in terms of your own well-being, you know, use the services that are available across, you know, your organisation and other places. So you might have an employee assistance programme, for example. Make sure you're aware of that, and make sure your members are aware of that as well. It's really useful to have a bank of resources available that are specifically available for Black people and people of colour. So there's organisations like Black Minds Matter, the Black African and Asian Therapy Network. Make yourself aware of them and make sure your members are aware. You know, encourage your organisation to publish that as well. Flair, and I just saw someone from Flair is actually at this meeting, recently posted on LinkedIn a list of really good organisations that people can reach out to. So I'll share that link to their post in the chat afterwards. But, you know, look around for these things, make sure they're available. And, you know, in terms of the network, make sure that it's a safe space. Psychological safety is really important in these kind of groups. So, you know, talk to them, ask them what that means for different people, because it will mean different things for different people, and, you know, create that safe space. And, you know, as I said, signpost and make sure they're aware of other services, both internal and external, and otherwise use your position to advocate and influence the organisation to be more inclusive. So as I mentioned earlier, in terms of mental health first aiders and making sure they're representative, although it's the organisation's responsibility to make sure that that's the case, there's no reason that as a race network lead you can't be proactive and approach other members of staff and say, we want to be involved with this and we can help you recruit mental health first aiders that are people of colour. So use your position as well.